This week on Healthy Living, what is preeclampsia and how does it affect pregnant women? When is the right time to discuss sexual education with children? We get your take in our Word on the Street segment. And can a fetus feel a mother's various emotions? We'll hear from an expert on if this may be true or false. Finally, a recent study shows a connection between obesity and those living in rural areas. We'll tell you more in What's New. Hello and welcome to Healthy Living. I'm Linord Moudou. Preeclampsia is a serious health problem for pregnant women around the world. It is a pregnancy complication characterized by high blood pressure and signs of damage to other organs, most often the liver and kidneys. The World Health Organization says preeclampsia affects 2 to 8% of pregnancies around the world. A new test can quickly identify the dangerous condition during pregnancy and help keep mothers and babies healthy and safe. VOA's Carol Pearson has more.
When Jessie Przezinski was pregnant with her first child, her feet got swollen.
Well, you hear everybody tells you, the swollen ankles and, get your feet up and all that. And so that was kind of where I just thought, okay. And then it started to be, kind of looks like it's in my arms and my hands too.
Swelling can also be a sign of preeclampsia. Preeclampsia is a complication of pregnancy. It puts the health of both the mother and the baby at risk. It raises the mother's blood pressure and affects the blood flow to the placenta. This can lead to smaller or premature babies. Untreated, it can be fatal to mom or the baby.
One of the hard parts with preeclampsia is there's a lot of symptoms of just pregnancy alone and other medical conditions that have similar symptoms that the women experience, like high blood pressure, headaches, changes in vision. Those can be contributed to a lot of other things.
Researchers at the Ohio State Wexner Medical Center have developed a fast and easy test to diagnose preeclampsia.
It is so easy to use, it's non-invasive, and it's takes very little resources to actually conduct the test.
Preeclampsia is more serious if it occurs earlier in the pregnancy or in a woman who had high blood pressure before getting pregnant. It's best for both mothers and babies to manage this condition as soon as it's diagnosed.
Without the certainty of this test aiding in the diagnosis, we as providers are definitely overcautious, as this is definitely something we don't want to miss because of the life-threatening results of a misdiagnosis for moms and babies.
Because of her preeclampsia, Przezinski was induced 3 weeks early. She had a successful second pregnancy and has this advice for other women.
The biggest thing is listening to your body.
The test is so easy, women can take it at home. That way, preeclampsia can be treated as soon as it develops. The researchers expect the test to be approved by the Food and Drug Administration in the next few years.
Alise Howe is a certified nurse midwife. She tells us more on preeclampsia.
Most pregnancies, everything goes very well. In a very small percentage of women, there is a condition called preeclampsia. In a very small percentage, it's their body is having a hard time with the pregnancy. And so this particular set of symptoms can lead to something very dangerous. And so across the world, that is one of the highest maternal mortality causes. When I'm talking to my clients, I tell them, if you start noticing an unusual amount of swelling, that especially a swelling that happens very rapidly, not just some swelling in the ankles, but some swelling that might not be going away with rest, some swelling that might be increasing. Some other signs are a very bad headache. Sometimes people will have some blurry vision or spots, floaters in their eyes, something in their vision. Some women will notice some pain here in the upper right side of their belly. That's specific to that. And so if you start noticing any of those signs or symptoms, seeing a provider is one of the first things that you would want to do. The chances of having it get higher the longer the pregnancy has progressed, If the person is less than 20 weeks, it wouldn't be defined as that if they had high blood pressure or any of those symptoms. So it could really happen anywhere from 20 weeks on, but it is much more rare to happen earlier in the pregnancy. There are some risk factors. So one is if somebody has already had preeclampsia with a previous pregnancy, they may have it again. And if they've had any of those symptoms of the previous pregnancy, make sure they mention it to their care provider. It is more common to happen with a first baby. It's more common to happen in the extremes of ages with pregnancy. So the very young and older women also have a little bit of a higher chance to have that. There are some other kind of signs and symptoms, but the truth is that anybody is at risk to have this as a potential complication. Anything that affects the mom has the potential to affect the baby. So a mom whose blood pressures are not well controlled, it can affect how well the baby is doing on the inside, how much blood and nutrients and all of that is going to the baby. So some babies may not grow as big as they need to. And also those babies are at risk if there is a placental abruption, it becomes a very serious medical emergency, and we would need to deliver that baby very quickly, regardless of how far along that mom is. If she is very premature and it is not very severe, we can give some medications that can help to prevent complications and give some medications that can help mature the baby in case early delivery is necessary. If she's close to term and there's nothing that's preventing us from inducing, we might induce a labor at that point in time to help deliver, because delivery is the best cure. We have some strategies that can help reduce the risk. So nutrition is a big factor. Some women that have had previous preeclampsia, they may start them on a low-dose aspirin during the pregnancy, and that has been shown to help to prevent some cases of preeclampsia. The reality is we have to take that watchful waiting and education stance to really see what's happening and make sure that people know. So that's why I wanted to talk about this particular topic today.
Sexual education for young people is often a controversial subject. According to experts, sexual education is designed to help young people gain their information, skills, and motivation to make healthy decisions about sex and sexuality throughout their lives. We traveled to Abidjan, where we asked, what age is too early or not early enough to talk to younger generations about sex? Take a look.
En Côte d'Ivoire ici, au niveau du code civil.
Here in Côte d'Ivoire, the civil code stipulates that a young woman can get married starting at age 16 with parental consent. So if the law allows someone to get married, it means the law allows that person to become sexually active. So we must prepare children at an early age, and that preparation does not start with sexuality. You build the child's character and progressively integrate some elements on sexual education.
Sexuality in Islam.
Regarding sexuality in Islam, when we know that the child can make a distinction between good and evil, between what's right and what's not right, then we can speak to the child about sexuality because Islam explains everything.
Today we have to talk about sexuality, but in a measured and responsible way. And we have to empower children and tell them, for example, what you are going through is not unique. I went through the same thing and this is how I handle it. And this is what you must do to address it. Because there are times that are shaky. At 16, 17 years, 18 years, 14 years, it is the time when the body is asking for certain things. And there are even important changes in the body. What are those changes? The child who did not get a word from the mother or the father is scared. And that fear needs to be addressed by giving children some sound advice.
Whatever the appropriate age may be to discuss sexuality with the younger generation, one thing is certain, sex education for young people cannot be ignored, according to experts, because it is necessary in their sexual development and well-being. It is often said that babies in the womb can feel their mother's emotions, joy, fear, stress. Many people believe it, but others are not so sure. Can the fetus feel the mother's emotions? We asked Dr. Michelle Fernandez, a researcher at the University of Oxford in Great Britain. Take a look.
from the studies that had looked at the effect of maternal stress during pregnancy on how the fetus and the very young child responds to stress in high-income countries, so mainly in the Western world, in Europe and the US, some studies from Australia, what they found was what we call in statistics a linear association, which means that the more depressed the mother got, the more abnormally her child would respond to a stressor. So the stressor could be anything from an injection to the way the child interacted with siblings and the mother as well. And this is called a linear association, and that basically means as the depression in the mother increases, the risk for the child increases. What we found in my study was very different. We found what we call a U-shaped association. So sort of when you look at it, it actually does look like a U. And that basically showed us that the children of mothers with both very high and very low levels of depression, anxiety, or psychological stress during pregnancy showed abnormal responses to stressors, either as fetuses or as children. But the fetuses and the infants of mothers exposed to who had moderate amounts of depression, anxiety, or psychological stress during pregnancy actually showed better performance. So they showed the lowest responses, the best responses to these stressful influences. And that was very different because what we were seeing in Western countries was as the mother's more depressed, you see worse outcomes in the child. But what we were seeing in rural South India, where we conducted the study, was actually that is not the case. Both very high levels and very low levels of stress in the mother during pregnancy seem to be maladaptive to fetal and infant brain development. But there's some amount of middle ground, sort of moderate stress exposure, which is good and conducive for fetal and also infant brain development. And it was interesting because we showed this at two very different time points. We showed this during the third trimester of pregnancy, and then we showed this again at 2 months post-birth, and we still saw these same U-shaped curves where too little and too much stress in the mother seems to be maladaptive, but some amount of moderate stress seems to be conducive to fetal and infant brain development.
A new study says obesity is increasing more rapidly in the world's rural areas than in cities. The research, led by Imperial College London and published in the journal Nature, analyzed the height and weight data of more than 112 million adults across urban and rural areas of 200 countries and territories between 1985 and 2017. The study found that more than half of the global rise these past 33 years was due to increases in body mass index in rural areas. In some low and middle income countries, rural areas were responsible for over 80% of the increase. The researchers point to several factors, including more mechanized agriculture, increased car use, a shift towards higher incomes, and the consumption of processed and low-quality food. We asked a farmer in the Democratic Republic of Congo if he consumes the food he produces.
I always divide my harvests in two. I sell one half and I take the other half home. For example, if I have 3 bags of cassava, I would sell 2 and keep 1 for home to help with our needs. Here in my farm, I have some cassava and some beans. I could add later soy and corn. The only problem I have here is that the climate is not favorable for soy, onions, garlic and tomatoes. It is disappointing, and that's why I often have to rely on other products.
And that's our show for today. For more on today's topics or for your questions, visit voanews.com. You can follow me on Twitter at Linord Moudou. Until next time, stay well and strive to make every day a healthy day.